We clearly know that by far the most effective way to protect yourself is using an N95 respirator or a KN95. We see a surge in cases like might happen with B117. We could go through those very quickly again. So it is very important that we try to reserve those as much as we can. I think the KN95s that are coming in from Asia, unfortunately, some of those are really of very poor quality. And some are of good quality. The challenge is knowing which are which, and that has been a problem. So I would definitely urge that we reserve the N95 for the healthcare workers.
It's true that N95s, to achieve that 95% effectiveness, it comes with a fit test, which is conducted in hospitals where they put a hood over you and they spray things in there and see if you can still smell them or taste them on your tongue. And, I don't expect that the general public would be able to do a fit test easily. And so, but I don't think that means that N95s are off limits to the public. I think that, if you can acquire them and you are careful about how they fit, they can be a big upgrade to your current mask setup. I don't think there's any harm in wearing them, of course, unless there's a shortage, and we should be saving them for healthcare workers. Masking in the community does reduce transmission. It slows the growth of the number of cases. Simple cloth mask, if it's made out of a tightly woven material and fits well, protects others and can protect the wearer. So the filtration works in both ways. It's able to remove viruses, both that you might breathe in from the air around you and that you might release into the air if you happen to be infected.
Research that came out of work that we did with our colleagues at Stanford was that static electricity can actually really improve the filtering capacity of masks, because actually the static electricity repels the virus particles. So if you have one of those masks that has an insert, that you can stuff in the middle of the mask, it's very simple. You use triboelectric charging, which is like you put rubber gloves on and just rub the rubber gloves on that insert and just give it a little static charge. And that static charge, our research showed, really improved the filtering ability of that mask, because that static charge repels the virus particles. So it was pretty effective in our research. And it's a pretty easy thing anybody can do.
Check the fit. Do you feel air moving out through your nose and through these areas? Because anywhere, if the mask is too tight, you're going to get gaps, and if it's too loose, you're going to get gaps. And then it's like from the ventilation and things, you might be great if somebody's standing right in front of you, but somebody standing to the side or behind you or through the air conditioning vents, it's going to travel right through right through those gaps. So you want to try to avoid gaps, and so that's really important for fit.
The most common kind of poor masking practice I see is the mask kind of either purposely or sagging off or accidentally kind of hanging off the nose so that the nose is sticking out. So there you lose the benefit of the mask almost completely, especially for your own protection, because you're probably breathing through your nose and there's nothing covering your nose.
We wash our clothes on a regular basis. We should watch our face coverings on if they're washable. You should wash them on a regular basis.
So with the N95s, you don't want to wash them because that will damage them. And how long can you reuse them? It's not clear. I know that we did some testing last year looking at decontamination of them for healthcare workers, and it was over 10 different cycles. So if the worker wears it for 8 hours and then you decontaminate and then they wear it the next day and that happens 10 more times, we're looking at 10 days of use. They're pretty tough. I think the weak point on N95s is the elastic straps, really, rather than the material itself. Of Of course, if you see any damage to the material, that means it's time to get a new one. I've heard, I think the best way to handle your N95 is, kind of avoid touching the front of it. When you're not using it, put it aside. Some people say put it in a paper bag. I would say if you can put it in the sun, that's even better, because the sun disinfects and kills viruses, within an hour easily. You have to be careful once you start adding more and more layers, because it can be hard to breathe through, and then you're going to end up pulling in more air through any gaps around the sides. So there's definitely a point of diminishing returns. I wouldn't really go more than 2 layered on top of each other.
Oftentimes, you can put that KF94 mask underneath a cloth mask. That's kind of the double masking. You can commonly see that. That's the white mask that people wear underneath a cloth mask. And so people may want to do that when they're in a taxi cab, when they're in a subway car, when they're in those community closed public spaces, and they don't know if they're going to be around somebody who could potentially be carrying the new variants.